In today's lecture, we will study the histology of blood vascular system. So before starting the histology of blood vascular system, we will revise the general anatomy of circulatory system. So let's begin with the right atrium. So the right atrium receives deoxygenated blood or impure blood from all over the body through superior vena cava and inferior vena cava. The blood passes from right atrium to right ventricle through the tricuspid wall. So the tricuspid wall governs the flow of blood from right atrium to right ventricle. Now the blood from the right ventricle enters into the pulmonary trunk. So the pulmonary trunk arises from the infundibular part of the right ventricle, and this trunk then divides into right and left pulmonary artery. So the pulmonary artery carries impure blood to the lungs. Now the blood is purified by the lung and the oxygenated blood enters into the pulmonary veins. So these pulmonary veins will open into the left atrium, and from the left atrium the blood will pass to the left ventricle through the bicuspid wall or mitral wall. In the vestibular part of the left ventricle there is opening for the ascending aorta. So the ascending aorta arises from vestibular part of the left ventricle, and the blood from the large elastic aorta will pass. The aorta will then give its branches. These branches will divide and redivide to form smaller muscular arteries. The muscular arteries will again divide and redivide to form smaller vessels known as arterioles. The arterioles will divide to form meta-arterioles, and the meta-arterioles will split into capillary. So the capillary is the part of blood vascular system where actual exchange of nutrients and gases take place at the level of tissue. Then the impure blood or deoxygenated blood and the waste products are carried by the venules. These venules will unite and they will form the smaller veins. The tributaries or the smaller veins will unite and they will form a large vein, and ultimately the blood, the impure blood through all the veins will either move from superior vena cava or inferior vena cava into the right atrium. So the right system of the heart is pulmonary system, and the left side of the heart forms the systemic system. The function of these blood vessels is to carry or to transport nutrition, then exchange of gases, excretion of waste products. Also the vessels maintain internal environment of the body. Blood vessels can be classified or grouped as arteries, arterioles, capillaries, venules, and veins. Arteries are the blood vessels which carry blood away from the heart. So the large or elastic arteries are about 10 millimeter in diameter. Such large elastic arteries like aorta divide and redivide into branches, and they form medium-sized muscular arteries which are about 2 to 10 millimeter in diameter. Then the muscular arteries again divide and redivide to form small arteries of about zero point 0.1 to 1 to 2 millimeter. Okay, then the small arteries will divide and they will form arterioles. Arterioles are the smallest arteries that deliver blood to the capillaries. Thus we can compare the arteries with a tree. Like tree has a stem, the stem divides to give branches. These branches further divide to give smaller branches. Similarly, a large artery is there and it divides and redivides to form smaller and smaller arteries. After that, arterioles will open in, or they'll split into capillaries. The capillaries are smallest vessels, and these are the site where actual exchange of nutrients occur between blood and tissue. These capillaries will then form the post-capillary venule, and these are 10 to 50 micrometer in diameter. The post-capillary venules will then unite and they will form muscular venules. The muscular venules will unite and they will form small veins. Small veins are about 1 millimeter in diameter. Such small tributaries or small veins will unite and they will form medium sized vein, and the medium sized veins will unite and they'll form large vein of more than 10 millimeter diameter, which ultimately drains into the heart. So we can compare the veins with the river. Like a river is formed, a large river is formed by union of small tributaries. Similarly, the veins carrying blood towards the heart is formed by union of small veins. All the blood vessels, may it be heart, arteries, arterioles, capillary, venules, or vein, they are all lined by simple squamous epithelium. So the epithelium lining the internal surface of cardiovascular system is known as vascular endothelium. When we see this under microscope after doing H&E staining, the endothelial cells appear flat. These are flattened cells. They show small amount of cytoplasm and they have elongated, flat, densely stained nucleus. Functions of endothelium. The endothelial cells produce factors that control coagulation of blood. Under normal condition, clotting is inhibited, and when required, coagulation can be facilitated. The endothelial cells also secrete various substances that produce vasodilatation. They influence the tone of muscles in the vessel wall. And the endothelial cells are sensitive to alteration in blood pressure, blood flow, oxygen tension. If there is any adverse stimuli like cytokines, the endothelial cells will undergo changes that will facilitate passage of lymphocytes through vessel wall. And in case of acute inflammation, the endothelial cells will again allow neutrophils to pass through the blood in the surrounding tissues. And the endothelial cells under the influence of histamine produces allergic states or allergic reaction. It becomes highly permeable. It allows proteins and fluids to diffuse from blood into the tissue, and as a result there is accumulation of fluid in the tissue. It is known as edema. Histologically, all the blood vessels are formed by three basic layers. So if we take the transverse section of any blood vessel, it shows three layers. So the innermost layer or the innermost coat of the blood vessel facing towards the lumen is known as tunica intima. The tunica intima is lined by vascular endothelium. So this is the tunica intima. Second layer or the second coat of a blood vessel is known as tunica media. It is mainly formed by elastic fibers and smooth muscles. So in case of arteries, the tunica media is thickest layer. So this much is the thickness of tunica media. Then the outermost covering or the outermost layer of the blood vessel is known as tunica adventitia. So in the veins, tunica adventitia is the thickest layer. So this one is the tunica adventitia. It is mainly formed by the collagen fibers. Innermost layer of the blood vessel is known as tunica intima. Tunica intima is formed by endothelium, subendothelial connective tissue and internal elastic lamina. The endothelium is lined by simple squamous epithelium resting on basement membrane, and the endothelial cells or endotheliocytes are flat elongated polygonal cells, and beneath the endothelium we have subendothelial connective tissue, which consists of loose connective tissue and collagen and elastic fibers. Then beneath the subendothelial connective tissue we have internal elastic membrane. It is the identification feature, or it is more prominent in veins than the arteries. The internal elastic membrane consists of fenestrated elastic sheets that permit transmission of nutrients to the outer wall of blood vessels from the lumen. Tunica media is the middle layer of blood vessels. It is formed by concentric layers of smooth muscle with elongated nucleus, and the smooth muscle also produce elastic fibers and collagen fibers and the ground substance. Tunica media is thicker in arteries than in veins, and the external elastic lamella separates tunica media from tunica adventitia. Thus, the composition of tunica media is mainly the concentric layer of smooth muscle with elastic and collagen fibers, and outer on the outer aspect of the tunica media we have external elastic lamella which separates it from tunica adventitia. Again, histologically the external elastic lamella is thinner than internal elastic lamella, and the smooth muscles present in tunica media are under control of autonomic nervous system. The sympathetic innervations cause vasoconstriction, that is they cause contraction of the blood vessels. Also, the smooth muscle cells are under control of endothelium derived growth factor. Tunica adventitia is the outermost layer of a blood vessel. It is mainly formed by, means the major constituent of tunica adventitia is collagen fibers. Also, few amount of elastic fibers, fibroblasts and macrophages are present here. And the peculiarity of tunica adventitia is presence of vasa vasorum and nervi vasorum. So, vasa vasorum are the blood vessels supplying the wall of vessel. For example, we'll take a large artery like aorta. So, in the tunica adventitia of the aorta, we get vasa vasorum. It is a small blood vessel that supplies the walls of aorta. Then nervi vasorum is the nerve supply of blood vessel. These are unmyelinated postganglionic sympathetic nerve fibers, and they mainly cause vasoconstriction. So they release norepinephrine and cause constriction of blood vessels. Here we will see the basic structure, or we will revise the basic structure of blood vessel. So the innermost layer is tunica intima. So this is the tunica intima. It is lined by simple squamous epithelium. So this is the vascular endothelium. This is resting on the basement membrane. So this is the basal lamella or the basement membrane on which the endothelium is resting, and it is covered by the internal elastic lamella. So these three layers will form the tunica intima. There is endothelium, subendothelial connective tissue. This is the subendothelial connective tissue, and the internal elastic lamella. The second layer is tunica media. It is mainly formed by the concentric layer of the smooth muscle and also elastic fibers and collagen fibers may be present in tunica media, and above that this is the external elastic lamella, and this forms the tunica media. So the tunica media is formed by the smooth muscles and external elastic lamella. Tunica media is thickest in blood in the arteries. Then comes the tunica adventitia. So tunica adventitia is mainly formed by collagen fibers, also the elastic fibers and fibroblast and macrophages may be present, and tunica adventitia is the thickest layer in veins. So remember that tunica media is thickest in arteries and tunica adventitia is thickest in veins. Again, in the tunica adventitia we have the blood vessels that supply the wall of the blood vessel. So this is the vasa vasorum and this is the nervi vasorum. The blood supply and the nerve supply of blood vessel is present in the tunica adventitia. The blood vessels are classified based on their anatomical structure as elastic arteries, muscular arteries, arteriole, capillary and sinusoids, venules, veins. Depending on the function of blood vessels, they are classified as conducting vessels. So the large vessels arising from the heart are known as conducting vessels, and these large arteries like aorta will divide and redivide, and they will form the muscular arteries, and the muscular arteries are known as distributing vessels as they distribute blood to different organs. Then as the arterioles at capillary sphincters provide resistance, so these are also known as resistant vessels, and the exchange of gases and nutrients occur at the level of capillaries and sinusoids, so these are known as exchange vessels, and the veins can dilate and they can reserve the blood, so these are known as capacitance or reservoirs. Blood vessels are broadly classified into three types: arteries, capillaries, and veins. Arteries are the blood vessels which carry blood away from the heart. Capillaries are the vessels where actual exchange of gases and nutrients occur, and veins are the vessels which will carry blood towards the heart. So veins will carry blood towards the heart. Now the arteries are further classified based on the characteristics of tunica media as large arteries or elastic arteries, muscular arteries or medium-sized arteries, small arteries and arterioles. So the elastic arteries are large arteries mostly arising from the heart like aorta, and these are also known as conducting artery as they conduct blood to the muscular arteries, and they have multiple layers of smooth muscles and elastic lamellin tunica media. So in the tunica media of elastic artery, more amount of elastic fibers are seen. And the example is aorta, brachiocephalic artery and subclavian artery. The second variety means the elastic arteries will divide and redivide to form muscular arteries. These are also known as distributing arteries as they distribute blood to the body, and these are medium sized. In the tunica media of muscular artery, more amount of smooth muscles are present and less elastic lamellae are there. Example of muscular arteries: radial artery, ulnar artery and temporal artery. Then the muscular arteries will divide, redivide, they will form smaller arteries of about diameter less than 50 to 100 microns, and in the tunica media of small arteries about 8 smooth muscle layers are present, up to 8 layers are there. Then these are small arteries will divide to form arterioles. So the arterioles are smallest branches of the arteries. They have only a single layer of smooth muscle. They again divide into terminal arteriole where the diameter is less than 15 to 20 micron, and the terminal arteriole will then branch and they will form meta arteriole whose diameter is about 10 to 15 micron. The second type of blood vessel is capillaries. So the capillaries are classified into three groups based on the continuity of endothelial cells and continuity of basal lamella. So first variety is continuous capillary. Here the endothelial cells as well as the basal lamella are continuous and the endothelial cells are communicated by the tight junction. Second variety is fenestrated capillaries. So they have fenestrated endothelial cells, but the basal lamella is continuous. And in the sinusoids, the endothelial cells are fenestrated and the basal lamella is also discontinuous. Then the third type of blood vessel is veins. Again, depending on the diameter of the blood vessel, veins are further classified as venules, small veins, medium veins and large veins. As discussed earlier, veins can be compared with the river. So as we see in the river, small tributaries will unite and they will form a big river or a large river. Similarly, here the venules, very minute blood vessels, they will receive blood from the capillaries and they will unite to form small veins whose diameter is less than 1 millimeter. Small veins will unite to form medium veins which usually accompany the arteries, and the medium veins will then unite to form a large vein like inferior vena cava, superior vena cava, whose diameter is more than 10 millimeter. Before moving to the histology of elastic artery, let us know the functional significance of elastic artery, why more amount of elastic fibers are needed in these large elastic arteries. So, when the left ventricle of the heart contracts during systole, a large amount of blood will enter in the elastic artery like aorta with considerable force, and thus the artery has to distend significantly, and the aorta is able to distend in a large amount because they have abundant elastic tissue in their wall. And again during diastole, when the left ventricle relaxes, the wall of these elastic arteries can regain their original size because of elastic recoil of their walls. Also, this elastic recoil will provide additional force to push the blood into smaller arteries, and thus there is fluctuation of pressure during systole and diastole. So this is the functional significance of elastic artery. During systole, they can distend, and during diastole, they can regain their original size. The elastic arteries are also known as conducting vessels because their main function is to conduct blood from heart to the muscular arteries. Now we will see the histological part. As other blood vessels, the elastic artery also has three layers. So this much portion is the tunica intima. The innermost portion facing towards the lumen is the tunica intima. Then there is tunica media, and the last one is the tunica, or the outer layer is the tunica adventitia. So first we will see the tunica intima. So tunica intima is lined by the vascular endothelium, which is simple squamous epithelium resting on the basal lamina. So this is the endothelial lining. Below that we have subendothelial connective tissue. So the subendothelial connective tissue is mainly formed by few smooth muscles, collagen fibers and elastic fibers. As it is elastic artery, more amount of elastic fibers are present in the subendothelial connective tissue. And the third structure, which is not so distinct, is the internal elastic lamella. So this is the internal elastic lamella. It is a fenestrated sheet of elastin. In large arteries, it is not distinct because in the tunica media also we have so many elastic fibers. So it will not be demarcated. That's why. Coming to the second layer of elastic artery, that is tunica media. So this much portion is the tunica media, and it consists of vascular smooth muscles. So these are the vascular smooth muscles. and they form concentric layers. They produce elastic and collagen fibers, and they are separated by concentric fenestrated sheets of elastic fibers. So these are the elastic fibers. We know that tunica media is thickest layer, and its main composition in elastic artery is elastic fibers. Most prominent feature of elastic artery is presence of fenestrated concentric elastic membrane in the tunica media. In case of aorta, about 40 to 70 such elastic lamellae are present. So these are all elastic fenestrated concentric lamellae. And in between we can see these are the smooth muscles. So elastic fibers are more than the smooth muscles here. Again, in case of elastic artery, the internal elastic lamella and the external elastic lamella cannot be differentiated from the elastic lamellae of the tunica media. This is the main point where we can differentiate the elastic arteries from the muscular arteries. In the muscular arteries, internal and external elastic lamellas are distinct. They are clearly visible because in the tunica media smooth muscles are there. So there is different constituent, that's why these are visible. But in case of elastic artery, as already we have abundant amount of elastic fibers in the tunica media, we cannot differentiate these elastic fibers from the internal elastic lamella and the external elastic lamella. That is why in case of elastic arteries, the internal and external elastic lamellas are not distinctly visible. Now coming to the tunica adventitia. So this is tunica adventitia. It is the thinnest layer and it is strongest layer. It is strongest because it has abundant collagen fiber in it. So the feature of tunica adventitia is it consists of longitudinally running elastic fibers and collagen fibers. It shows presence of fibroblast macrophages, and again, as it is elastic artery, it has fine elastic fibers in it. And here we should know two structures, vasa vasorum and nervi vasorum. So vasa vasorum are the minute or small blood vessels which supply the walls of large blood vessels like aorta. So in case of large blood vessel like aorta, the tunica adventitia shows minute or small blood vessels known as vasa vasorum. So they supply the tunica adventitia and outer part of tunica media. Also nervi vasorum is present. It is the autonomic nerve that supplies the vascular smooth muscle and it causes vasoconstriction. So the sympathetic innervations cause vasoconstriction. Then coming to the function of elastic artery, as we have already discussed, the elastic arteries can distend during systole and they can regain their original size by elastic recoil during diastole. And examples of elastic arteries are aorta, brachiocephalic artery, then common carotid artery, subclavian artery, common iliac artery, and pulmonary arteries. Muscular arteries have the ability to alter the size of their lumen by contraction or relaxation of smooth muscles present in the tunica media, and the muscular arteries can regulate, they can govern the amount of blood flowing in the tissues or regions supplied by them. Therefore, they are known as distributing arteries. Muscular arteries are medium sized arteries. Their diameter is 2 to 10 millimeter, and the most prominent feature of muscular artery is presence of more amount of smooth muscle and less amount of elastic material in tunica media, and also the internal elastic lamellae is distinctly visible in the muscular arteries. And what changes occur from elastic to muscular artery? The elastic arteries will divide and redivide, and their diameter will decrease, their elastic fibers will decrease, and the smooth muscle fibers will increase to form medium-sized muscular arteries. Now, histologically, the muscular arteries again have three layers. Innermost is tunica intima, then there is tunica media, and the outermost is tunica adventitia. And the tunica media has the endothelium, vascular endothelium, which is simple squamous epithelium resting on the basement membrane. Then the subendothelial connective tissue is sparse. It has small amount of elastic fiber, collagen fibers, smooth muscles, and then comes the internal elastic lamella. So internal elastic lamella is prominent, or it is distinctly visible as a wavy structure in muscular artery. Note that it is not distinctly visible in elastic artery, but it can be seen in tunica intima of the muscular artery, and the reason is tunica media has more amount of smooth muscles, so the internal and external elastic lamellas are visible in muscular artery. So just to revise, the tunica intima has got endothelium, subendothelial connective tissue, and a prominent internal elastic lamella. Tunica media of muscular arteries have concentric smooth muscle fibers, and these are fusiform or spindle shaped. They have bulged central part and tapering narrow ends, and they are arranged spirally, and their main function is to maintain the blood pressure by either contraction or relaxation of smooth muscles. So the tunica media of muscular arteries have more amount of concentrically arranged layers of smooth muscle fibers, and there is small amount of elastic fibers and collagen fibers. The smooth muscle cells are connected by gap junction for rapid coordinated contraction. And here again the elastic lamella, external elastic lamella, is distinctly visible. Then the tunica adventitia has connective tissue. Then the muscular arteries are relatively having thicker tunica adventitia than the elastic arteries, and tunica adventitia also shows presence of vasa vasorum and nervi vasorum as we have seen in the elastic arteries. We will know the interesting facts about coronary artery. Coronary artery is an example of muscular artery. So in the tunica intima of coronary artery, the subendothelial layer has elastic fibers, ground substance. Also, it has monocytes, macrophages, then undifferentiated muscle cells and collagen fibers are there. Coronary arteries are more prone to thrombosis because of which there is blockage, and the reason is endothelial cushion. It is a good need is for deposition of platelets in coronary arteries. That's why they are more prone to thrombosis. And those arteries which have to undergo repeated stretching and bending, there the muscles have longitudinal arrangement. Normally the muscular, in case of muscular artery, the tunica media has concentrically arranged smooth muscle or circular arrangement of smooth muscle is there. But those arteries which undergo repeated stretching or bending, there the smooth muscles are arranged longitudinally. An example is coronary artery, then carotid, axillary and palmar arteries. So in this table, we can see the difference between elastic artery and muscular artery. Let's revise it. So we'll go layer by layer. If we see the tunica intima of elastic artery, the subendothelial layer is having significant amount. It is thicker, and the internal elastic lamellae is not visible in the tunica intima. Whereas in muscular artery, the subendothelial connective tissue is scanty and the internal elastic lamella is clearly visible. Then the tunica media, in case of elastic artery, the identification feature by which you can identify the slide, the peculiarity of elastic artery is presence of large amount of fenestrated elastic lamellae in tunica media. and very small amount of smooth muscles are present intermittently between the elastic lamellae. In case of muscular artery, less amount of elastic fibers are there, and the identification feature of muscular artery is presence of multiple layers of concentrically arranged smooth muscles in the tunica media. Then the tunica adventitia is thin in elastic artery. It is comparatively thicker in case of muscular artery. Examples of elastic arteries are aorta, carotid artery, subclavian artery, and example of muscular artery is brachial artery, femoral artery. Elastic arteries are also known as conducting arteries, and muscular arteries are known as distributing arteries. The muscular arteries divide and redivide, and they give rise to arterioles. Diameter of arterioles is less than 100 micrometer, and distally these arterioles will form capillary plexus. The arterioles are further classified as muscular or large arterioles whose diameter is 50 to 100 micrometer. Terminal arterioles, their diameter is less than 50 micrometer. Histologically, the terminal arterioles are devoid of internal elastic lamella. They are only covered by smooth muscle cells. And in meta-arterioles, the smooth muscles are replaced by pericytes. They terminate in capillaries, and the initial segment of meta-arterioles is surrounded by smooth muscles that forms the precapillary sphincter. So, the first type of arteriole is large arteriole, which is known as muscular arteriole, and it is 50 to 100 micrometer. It will continue as terminal arteriole. Diameter is less than 50 micrometer, and it is devoid of internal elastic lamella, but it has a covering of smooth muscle cell. And it will continue as meta-arteriole, where the smooth muscles are now replaced by pericytes, and sometimes the meta-arterioles are connected with venules by thoroughfare vessels or preferred channels. And arterioles mainly regulate the blood flow through capillary plexus, and they maintain the blood pressure. In meta-arterioles, we have smooth muscle cells replaced by the pericytes, which are also known as Roget cells. And again, there are some interesting things about arteriole, like contraction of the arterioles control the blood pressure at the level of precapillary sphincter, and this contraction is under myogenic control, and it is not neurogenic. It is in response to local vasoactive factors or metabolic factors, and the arteriole is densely innervated by sympathetic fibers. Sympathetic fibers are vasoconstrictor, we know, and it is also known as true bottleneck of the circulatory system, as it offers peripheral resistance, and thereby it regulates the systolic arterial pressure. So it is also known as a resistant vessel. And histologically, the arteriole also consists of three layers: tunica intima, tunica media, and tunica adventitia. So in tunica intima, there is vascular endothelium, that is simple squamous epithelium, and it rests on basement membrane. And there is small amount of subendothelial connective tissue, and internal elastic lamella is mostly absent in arteriole. It is present only in large muscular arteriole, but in terminal and meta-arteriole, the internal elastic lamella is absent. Then the tunica media is 1 to 3 layer cell thickness, and it has circularly arranged smooth muscle cells, and the terminal arteriole has only one layer of smooth muscle cells. Then again, here two interesting things are, as discussed earlier. There is precapillary sphincter at the initial segment of the meta-arteriole. So it consists of vascular smooth muscle cells that surround the terminal arteriole at its junction with capillaries. and the precapillary sphincter regulates the entry of flow and into the capillary plexus, and thus it maintains the blood pressure. Then it offers resistance. The smooth muscle cells of arterioles generate resistance to the blood flow by contraction, and they regulate the blood pressure. Then the tunica adventitia, here it is formed by thin connective tissue, and this tunica adventitia separates the arterioles from adjacent structures, and it is not clearly demarcated. This diagram shows the role of precapillary sphincters and meta-arterioles. So in first diagram we can see when the precapillary sphincters are relaxed, they allow the blood to pass through the capillary plexus. And in second diagram we can see when the precapillary sphincter is closed or contracted, then the blood is prevented from passing through the capillary plexus. Now we will see the applied importance of arteries. So there is a clinical term called atherosclerosis, which means hardening and narrowing of the lumen of arteries due to accumulation of plaque, and a thick layer of fibrous connective tissue called atheroma gets accumulated in tunica intima, and this will narrow the lumen of the blood vessel, and thus the blood flow is obstructed, and the blood vessels supplying a particular viscera will provide less blood to the viscera, and it will eventually lead to the ischemic changes in infarction. In case of heart, there can be myocardial infarction due to obstruction in blood supply, or in brain there can be stroke, paralysis due to obstructed supply to the brain. And the second condition is hypertension. So normally the systolic blood pressure is 120 millimeter of mercury and diastolic is 90 millimeter of mercury. So if there is sustained pressure more than 120 by 80 millimeter of mercury, then it is known as hypertension, and mostly it affects the old age people because degenerative changes occur in the blood vessels. There is hardening of the blood vessels, reduced elasticity, deposition of collagen fibers, then increase in the amount of vascular smooth muscles, which eventually causes vasoconstriction, then atherosclerosis. These all factors are responsible for hypertension. Then the third condition is aneurysm. Aneurysm means dilatation. So dilatation of the arterial wall occurs due to weakness of its walls. When the arterial walls are weakened, these are the site where dilatation occurs, and aneurysm is mostly associated with replacement of elastic fibers with collagen fibers, and it is seen in old age due to atherosclerosis. Then there is syphilis, which is a sexually transmitted disease caused by treponema pallidum bacteria. Then Marfan's disease is an autosomal dominant disorder, and Ehlers-Danlos syndrome. It is a genetic condition uh, uh, associated with the connective tissue disorder. So in these conditions, aneurysm is more common.